Okay. Bismillahirrahmanirrahim. Final quiz number 1.
Yeah.
The capacity of any medical test to achieve its desired outcome is known as A, appropriateness, B, continuity, C, efficacy, D, effectiveness. What's the answer? Capacity.
Third, capacity,
The capacity here.
appropriateness.
What's the answer? Capacity means?
Then I share the screen please. I didn't get this.
Not clear, Doc.
No, the share. I'm not able to share the screen.
You cannot see it? Not clear, the screen, Doc?
Oh, it's gone for me.
Oh, I shared already. Okay. This one. Is this clear? You can see now, Doc. Radha,
Yes, I can see.
Doc Gulam. Is the screen clear? Okay. So what's the answer here, Radha?
Appropriateness.
No, the answer here is when we say capacity, it is efficacy. Okay, this measures how well a medical test performs.
Okay.
Okay, efficacy is always meaning capacity. Okay, it's the capacity. It measures how well a medical test performs in achieving its intended purpose when properly applied. Okay, when we say appropriateness, so this refers to whether a medical test or treatment is suitable for a specific situation, not inability to achieve the desired outcome. And then continuity, this relates to the consistent and seamless delivery of healthcare services over time, not the effectiveness of a simple single test. When we say effectiveness, this is also like similar to efficacy, but effectiveness refers to how well a medical test or intervention achieves its desired outcome in real world conditions. So always remember here, efficacy is equals to capacity. Okay. Number 2, which of the following is the most common reason for failure of a quality improvement initiative? A, expectation that managers will become part of the change process. B, the expectation that the staff will become part of the change process. C, viewing quality improvement as a long-term process. D, viewing quality improvement as a short-term fix. Okay, what's your answer?
D.
Yes. Correct answer here is letter D. Because quality improvement, okay, is requiring the ongoing commitment, cultural change, and systematic approaches to ensure a sustainable results. And all other threes are are all correct, and one is wrong here. Okay, so which is the viewing quality improvement as a short-term fix? Because the most common reason for failure in quality movement initiative is viewing it as a short-term fix, which undermines the sustained efforts and systematic changes that required for lasting improvement. For letter A, this one is engaging the managers is beneficial for the success of the quality improvement, which is correct. For letter B, involving staff for the successful of implementation is correct. but and then this is not the reason for failure. And letter C is treating quality improvement as a long-term process is the correct approach for sustained success. Clear? Okay,
Yeah.
number 3. Management using quality improvement principles should emphasize the importance of A, staff orientation, B, customers' expectations, C, quarterly statistical reports, D, team development. What's the answer here?
B.
Okay.
Customers
Radha?
expect, customers expectation.
Okay, both of you, very good. Because this drives the improvements and ensures alignment with the needs of the patients and the stakeholders. Why not staff orientation? This is not the primary focus of the quality improvement principles. Letter C, do not emphasize the underlying purpose of meeting the customer expectations. For letter D, the team development is also not the primary focus because the primary focus is always the customer's expectations. For number 4, the appropriateness of care. Okay. Are you with me?
Yeah.
Okay. For number 4, the appropriateness of care is A, primarily a focus of utilization management, B, a key dimension of quality case, C, equivalent to case management, D, the degree to which healthcare services are coherent and broken. What's the answer?
It's B. It is a key dimension of quality of care.
Letter B. This
Yeah.
very good. A key dimension of quality case. Okay. Number 5, a medication is ordered for a diabetic patient. Its capacity to improve the status as a dimension of quality or performance is its A,
Efficacy.
effectiveness, B, potential, C, appropriateness, D, efficacy. Capacity?
And
Yes,
Very
efficacy.
good. Efficacy. Very good. Number 6, the dimension, that dimension of quality performance that is dependent upon evaluation by the recipients and or observers of care is A, respect caring, B, safety, C, continuity, D, availability.
Respect and caring.
Hmm?
A. Recipients, respect and caring.
Yes, this is the correct answer. Okay. So which of the following element must be present in order to evaluate effectiveness of healthcare organization quality improvement program? A, integrated data collection, B, quantified objectives, C, well-defined organization culture, D, well-educated medical staff.
B. Quantified objective.
Okay. Radha, what's your answer?
Yes, it's quantified objective.
Okay, very good. Because when we say quantified objective, it is the goal that is specific, measurable, and includes numerical targets to track progress or achievement. Okay, why not letter A? Because data collection alone does not provide a framework for evaluating effectiveness without specific objectives. And letter C also not a direct requirement for evaluating the program effectiveness. A well-educated medical staff contribute to implementation, but the presence of the quantified objective is essential for evaluation. For number 8, after administration of flu vaccine, the quality professional measures how many people caught influenza after administering the vaccine. So in this case, which dimension she measures? A, efficacy, B, process, C, availability, C, appropriateness.
Efficacy.
Radha, what's your answer?
1 minute. How many people?
Measures how many people, okay? This is the clue word here. How many people?
Efficacy.
Efficacy, yes. Very good. So in this case, the quality professional is measuring the efficacy of the flu vaccine. Efficacy refers to the ability of the vaccine or capacity of the vaccine to prevent the disease, which is influenza, under control conditions. And by assessing how many people still caught the flu after receiving the vaccine, they are directly evaluating how effective the vaccine is at achieving its intended outcome. What about process? Process measures evaluates the steps involved in delivering care, not the outcome of care itself. And availability is referring to whether the vaccine is accessible to the population. And letter D, appropriateness measures whether the intervention is suitable for a specific population, not its actual success in preventing disease. Okay, number 9, which is best solved by quality team? A, system problem. B, customer complaints. C, financial problem. D, administrative problem.
System problem.
Hmm?
System problem.
System problem. Dr. Gulam?
Yes. Yeah.
Yes, very good. It is best solved by the quality team is the system problem because such issues typically require a structured, collaborative approach to analyze and improve processes, workflows, and outcomes. And the quality teams are equipped to address the system level challenges by identifying root causes and implementing solutions that enhance efficiency, safety, and overall performance. What about the customer complaints? This is, they may assist in addressing systematic issues causing complaints. Individual complaints are usually handled by the customer service teams. For financial problem, are typically managed by the financial or administrative teams. For the administrative problems are best addressed by the management teams. Okay, number 10, to integrate performance improvement within organization planning, there must be alignment between A, performance improvement team and human resources, B, strategic improvement objectives, C, measuring and monitoring performance results, quality control process, and systems. What's the answer? So the statement means what is the key, okay, the critical factor to integrate performance improvement within the organizational planning that lies in aligning what?
C.
Strategic.
Very good. B, strategic improvement,
Strategic.
improvement objectives,
Okay.
because this ensures that performance improvement efforts are purposeful, measurable, and directly contribute to the organization's long-term success. For letter A, it's not a critical factor for integration, the performance improvement team in human resources. For letter C, this one is also essential for tracking progress, but alignment with the strategic objectives ensures these efforts are meaningful and aligned with broader goals. So both are important, but the critical factor or the key is the strategic improvement objectives. For number 11, total quality management philosophy assumes that A, most problems with service delivery results from systems difficulties. B, frequent inspection is necessary to improve quality. C, most problems with service delivery result from difficulties with individuals. And letter D, top management leadership in quality activities. This enfranchise employees.
A.
What's the answer?
A.
Most problems with the service delivery result from system difficulty.
Okay, very good. What's your answer, Doc Gulam?
Yeah. Yes. A.
Okay, yes, correct. The total quality management TQM philosophy assumes that the majority of problems in service delivery are caused by systemic issues rather than individual errors. It emphasizes the improving system and processes to enhance the quality and performance. Because according to TQM principles, approximately 80% of problems stems from system level deficiencies. Following the what principle?
80-20 principle. 80-20 Pareto principle.
80, which follows the
principle.
Pareto principle. So when we say Pareto principle, suggests that 80%, okay, out of outcomes result from the 20% of causes. Okay, so letter B is incorrect because the TQM focuses, like I said, on process improvement and prevention rather than reliance on inspections to identify problems. For letter C, this is also incorrect because this one is not due to individual faults or failures. Okay, because primarily, as I said, TQM focuses on the system-related issues. For letter D, TQM promotes active leadership and employee empowerment, not disenfranchisement. Well, and when we say disenfranchisement employee, this refers to the deprivation of certain rights, privileges, or access to opportunities. So this is the meaning of disenfranchisement. Okay, so moving on to number 12. The critical values are determined by A, regulations and laws, B, accrediting body, C, organization, D, literature. Yes. What's the answer? Who is determining who determines the critical value?
Yes, the organization.
The organization. Radha, what's your answer?
Confusion. Organization.
Okay. Organization. Very good, both of you. Critical values are determined by the organization basing on its policies, procedures, and clinical guidelines. Well, for the other three, they are not responsible for the determination of the critical values. So it is always the organization. Okay, where are we now? Number 13. Obstetric outcome for morbidity. A, normal delivery. B, cesarean. C, neonatal death. D, postoperative septicemia.
D.
Morbidity.
D.
Letter
Postoperative
D.
septicemia.
Yeah, okay. It's letter D. So when we say morbidity, this refers to complications or health conditions resulting from a medical procedure or illness. So in obstetrics, postoperative septicemia, which means an infection occurring after surgery, is a morbidity outcome as it reflects a complication affecting the patient's health. Why not normal delivery? What is the normal delivery here? Is it a
Normal.
process or an outcome?
Normal delivery is an outcome.
This is
Process lead
a
to outcome.
process. It's a process and represents a standard outcome, but this is not a morbidity. Okay, I will repeat. Normal delivery is a process and represents a standard outcome, which is not morbidity. Cesarean. This is similar to normal delivery. A cesarean is a process or procedure, not a morbidity outcome. For neonatal death, is it morbidity or mortality outcome?
Mortality.
Yes, very good, mortality. Neonatal death refers to the death of a newborn within the first 28 days of life, which is categorized as a mortality outcome because it represents the ultimate endpoint of life rather than a disease or condition. Okay. Number 14, performance improvement plan. So you have to order or arrange. So which one is the first one?
Make commitment.
Okay. So we have A,
And
gathering baseline data. B, evaluate effectiveness and
Gathering data.
improvement. C, make commitment. D, implementation. What's
yeah,
number
C.
one?
C, make commitment.
Okay, very good. Number
Then
one.
gather
Number two,
baseline data.
Gathering data.
very
Then-
good. Number three,
Then implement D.
Implementation.
very good. Number four,
Evaluation.
very good. Bravo. Okay. Number 15, a health organization is becoming a member in a health plan. The most important educative program to be delivered to the staff is A, organization change, B, conflict of interest, C, consumer needs, D, accreditation needs.
Consumer needs.
What's the answer?
Consumer needs.
Accreditation needs. Very good.
Sorry? No. Consumer
Accreditation
needs.
Hmm?
Consumer needs.
Accreditation needs.
Yes, that's the correct answer. Accreditation needs. Okay. When a
Sorry,
healthcare organization becomes a member of a health plan, it must meet specific standards and requirements to maintain its accreditation. So, by educating the staff about these accreditation needs, ensures that everyone understands the expectations, the policies, and procedures required to comply with the health plan standards, which is critical for maintaining the organization's membership and reputation. For the three, organization change. What's your answer, Doc Gulam?
My answer is consumer needs.
Consumer needs?
Yeah.
Okay, consumer needs essential also here. But ensuring the
This
accreditation
is for
compliance,
accreditation.
accreditation compliance is the immediate priority for the staff.
Because accreditation usually you will get like once in 3 years, once in 2 years. But the question is that when the plan is taken, they should primarily they should be educated regarding what the consumer needs. Then they can plan according to this plan. This is my because accreditation it is a standard that should be universally given by the education first plan divisions, and this will be made like a throughout the year it will be a plan, but not specifically when it is merging with one.
Okay.
When it's becoming a member on the health plan, I think they should know what are the consumer needs.
Okay. But the answer here, Doc, I stand for my answer, which is accreditation needs. Because first is to educate the staff about these accreditation needs that they need to know all the standards policies before the for the consumer, which is your answer. So because we are talking about the accreditation compliance, Doc, so we are into this is the most priority for all the staff, which is the accreditation needs. What are all the things to know about the accreditation compliance? Okay, so this is the most important educative program, Doc. The accreditation needs. Okay. Shall we move on?
Yeah.
Okay, Doc. Thank you. For 16, a developing education training program in quality improvement, what component should be included? A, quality definition and principles. B, performance appraisal results. C, discussion of incidents. D, individual focus activities. What's the answer here? Number 16. Okay, the answer here is quality definition and principles. Okay, because when developing an education training program in QI or the quality improvement, it is essential to include the foundational understanding of the quality definitions and principles. So this provide the necessary framework for staff to understand the purpose and methodologies of the quality improvement, enabling them to actively contribute to the organization's improvement efforts. So they will form the basis for understanding and implementing quality improvement methodologies. For letter B, this is also can inform improvement needs, but they are not the core component of a quality improvement training program. as well as letter C, do not provide the foundational understanding needed in the quality improvement training. For letter D, QI emphasizes system-wide improvements rather than focusing solely on individual activities. Okay? So, number 17. Any questions for number 16?
No.
Okay, number 17, learning organization. A, adaptability, system thinking, and willing for challenge assumption. B, leaders' commitment and support and data rich and compliant. What's the answer?
Second, leaders' commitment.
Okay, what about you, Doc?
Yeah.
Leaders' commitment. Okay, the
Uh,
answer is letter A. Because a learning organization is characterized by its ability to adapt, think systematically, and challenge existing assumptions. It continuously evolves by fostering innovation, encouraging critical thinking, and enabling all members to learn from experiences. And these traits ensures the organization remains dynamic and responsive to changes. Why not letter B? Leaders' commitment and support are also important, but being data rich and compliant does not inherently define a learning organization. Compliance focuses more on following established rules rather than fostering a culture of learning and adaptability. Okay, in summary, a learning organization prioritizes these three, enabling a continuous growth and improvement in dynamic environment. For number 18, in a facility outpatient department, team wants to assess a relevant outcome indicator which of the following best to be used. A, number of admission to hospital. B, number of surgeries. C, claim data. D, number of dispensed drugs. What's the answer?
A.
Yes.
Number of admission to the hospital.
Yes, very good. It's relevant. Relevant outcome indicator, the number of admission to the hospital for an outpatient department, because this reflects the condition of patients and whether outpatient care was sufficient to prevent hospitalization. Outcome indicators means measuring the end results of care and how they impact to patients' health. So why not the letter B, number of surgeries? What is this? What kind of indicator?
Outpatient department it is, no?
What kind of indicator is
Outpatient
this?
department it is.
This is a process indicator. Okay?
Uh,
This is a process indicator. What about the claims data?
That also process indicator.
Okay. So this is the claims data tracks the financial or administrative outcomes. So for letter D, number of dispensed drugs. This is an output indicator that measures the volume of drugs distributed but does not assess the patient's health outcomes. For an outpatient department, okay, the number of the hospital admission is the best outcome indicator, as it what directly reflects the effectiveness of outpatient care in preventing the need for further hospitalization. Okay, so that's the rationale. Okay, number 19, appropriateness of appendectomy. A, pre-admission test. B, pathology test. C, age. And letter D is clinical test. So what's the answer?
Pathology test.
Pathology test. Doc Gulam, what's your answer?
Yes, pathology test.
Okay. The appropriateness of an appendectomy is best determined by clinical
Investigation.
clinical tests,
No,
which
it cannot be clinical test. It will be pathology test.
okay. Okay, I'll give you the reason, Doc. Which
Because
okay, a clinical test which provide the evidence needed to justify the surgical intervention. The pathology test here analyze the tissue after surgery and are used for confirmation, not for determining the appropriateness of the procedure. For the pre-admission test, this test may help with admission decisions, but do not determine the need for an appendectomy specifically. For the age, while age may influence risk factors, it is not a determinant of whether appendectomy is necessary. Okay, the appropriateness of an appendectomy depends on the clinical evidence, which is assessed through clinical tests such as physical examination, imaging like ultrasound or CT scans, and laboratory tests. And this determine whether the procedure is necessary based on the patient's symptoms and medical condition.
Yeah, you're right, exactly on this basis, but not given, yeah, absolutely right. Because we are the clinicians, we go on clinical tests, but unfortunately, these days they are assuming this as a pathology mainly. Because in the same question, in the other context, the answer was written as a pathology test. At the time, I was very upset, but this is the reason I had to do.
Okay, so are we clear now with this one?
I know it's from Robert. Right, I was clear about the clinical test, but unfortunately, in the other answer, it given as a pathology test. That's why I was become,
So you think that there is a conflict about it?
no conflict now. From as a clinician, I always believe the clinical test is the best answer. Yeah.
Okay, Doc. Okay, so it is the question. The answer here is clinical test, Doc.
Yeah.
Okay, so for number 20, last number, which of the following is the best way to determine if quality improvement initiative is successful? A, present findings to the Quality Council. B, conduct retrospective review. C, compare outcome with the pre-established goals. D, survey patients and customers.
C.
Yes, very good. Letter C. Okay, the best way to determine is through a quality improvement initiative is successful is to compare the actual outcomes with the pre-established goals of the initiative, because this allows for an objective assessment of whether the desired improvements were achieved. Why not letter A? This does not directly determine the success of the initiative. For conduct retrospective review, this helps analyze past performance but does not provide a clear measure of success against a specific goal. For letter D, the surveys provide valuable feedback but may not directly correlate with the initiative's predefined goals. To summarize, to evaluate the success of quality improvement initiative, it is essential to compare the outcomes with the goal set at the beginning of the project to ensure a clear and measurable assessment. Okay, so that ends our final quiz for tonight.
Nice. Thank you so much.
Yes. So any concerns?
No. It is good that
questions,
this
Doc?
question being clarified to me because the appendectomy question was clarified to me. It's good.
Okay, Doc.